I yield back.
Mr. Griffin and then Mr. Schock.
Thank you, Mr. Chairman. Thank you so much for being here. I've heard a lot of good things about your work from Leader Cantor, Eric Cantor. So thank you for being here, and I wish you well. I first wanted to say that, as I tried to indicate earlier, it's really a false choice to say it's Obamacare or all the things that were never fixed in the healthcare world have to continue. There are many different options in between there. I've signed on to legislation that would also deal with pre-existing conditions. So I just want to make clear to the public to imply that you have to take all of what Obamacare delivers to get to address pre-existing conditions, or you get none of that addressed. That's just not true. And we can have that debate. But I've heard from a lot of Arkansans. Read a message I got via website from a constituent. She says, her name's Jennifer in Little Rock. She says, quote, "I'm an Arkansas state employee, government worker. We received a newsletter from the Employee Benefits Division during open enrollment. Our insurance covers less now and costs more. It says, quote, these changes were made to more closely align the plans with the Affordable Care Act. And in another sentence, quote, because of this, the value of the plans were lowered to be more in line with the law, end quote. I am quite disgusted. Just because the federal government is starting a health insurance marketplace doesn't mean that my coverage needs to change. But it has, and it has changed for the worse. If you need a copy of this newsletter, please let me know. Thank you for working on this problem." I have a copy of the newsletter here. So there are a lot of people that tell that story, and I have pages of it. Yes, there are people that are getting covered because of pre-existing conditions. My point is you don't have to do it this way, and that's why a lot of us continue to have a problem with the law. Yes, we have voted 43 times or so. But what the talking points don't tell you is 7 of those votes became law because the president agreed to those things. So the idea that we've had the same exact vote 44 times is talking point nonsense. But I guess what I would ask you is, are these increased premiums and increased co-pays, is that just the cost of providing more access to health care? What do I say to people who ask, why am I paying more? Do I just tell them, hey, that's a tax? We didn't call it a tax, but it's a tax you got to pay so that more folks have access. Is that fair? Is that what it is, really?
What I would say to those folks is it's going to depend on their individual situation, because if they're in a group market where they already had group employer-sponsored insurance, that's a different situation. If they're in an individual market, what you can say to them now is they now have access to health care and they now have a competitive market.
So if you're paying...
All right, time has expired. Mr. Schock.
I appreciate you. Thank you.
Thank you.